We're a group that historically was based in Fredericksburg. We were a local group, local private group. We were about 25 to 30 radiologists for a long period of time. And then COVID happened, sort of the world changed as a whole, and radiology groups started to get bigger. And so over the last year, we've actually grown from about 40 radiologists to 67. We've had to grow because when you look at the paradigm of radiology and radiology services, it's fundamentally you have to have a certain amount of scale. You have subspecialty needs that require enough radiologists to be able to provide that. A lot of those subspecialty needs have become 24/7. We see radiology taking on a more integral role in things like stroke and cardiac disease. And so those tools don't just get used from Monday through Friday, 8 to 5. As of now, we work with 9 different healthcare systems, 13 hospitals between the healthcare systems. But we also have partnerships with a large OBGYN practice. We are now covering 40 sites across 4 states. In order to succeed, everybody knows that you can fundamentally compete or you can cooperate. And competition is fine and it's important and it helps drive innovation. But when you look at the impending and ongoing shortage, when you look at the gaps in care, you have to fundamentally figure out ways to help each other fill those gaps because there's just not an easy answer. We're not a teleradiology group. We are a radiology group that provides a mixture of on-site and teleradiology services because radiology is evolving. The days of a practice being able to be 12 radiologists in a hospital coming in every day, being around each other every minute, that doesn't exist. At the same time, there's value in one-on-one contact. There's value in terms of group culture. There's value in terms of the communication between radiologists and other physicians. At the end of the day, radiologists are the physician's physician, right? We are there to help other doctors take care of patients, in addition to taking care of patients ourselves. RAF has really evolved into that model of a hybrid on-site and off-site radiology workforce. It's a way we've also figured out how to appeal to the changing workforce. No longer are you forced to pick up and move if you want to work at a different job.